My cycles used to last, maybe 3 or 4 days, and they started lasting longer, sometimes a week and a half. And it was physically draining, and mentally I would just be in another world.
There are two minimally invasive procedures that we offer in the office setting. One is endometrial ablation. So this is a treatment procedure for heavy, painful periods. It is designed for those women who are done with childbearing and don't want to continue to be on medication to control menstrual cycles, don't want to have aggressive surgery like a hysterectomy for their menstrual cycles, but yet are having problems every month with their cycles.
We discussed different options, and she told me about ablation and exactly what the procedure was and what the outcome could be. And then I went home and did some research on the net, and then I finally had enough, and I called her up and told her, you know what, I'm going to go ahead and try it and just see what happens.
I basically counsel patients that if they have ever had to change their plans because of their menstrual cycle, they ought to consider a treatment of some sort, and this is a very, very good one for those patients who just want a one-shot deal and they're done.
The procedure was quick. I was in and out, went home, laid down, and the next day I was fine. I got up and was able to do my usual stuff around the house.
So they come in, the procedure takes pretty much an hour door to door. We do an IV sedation. They go home, and by the next day they're usually completely over the effects of the surgery and anesthesia.
There was no cramping of any kind, just slight bleeding, and that was it. I didn't have the terrible headaches that I had prior and during, and my second cycle I had no symptoms at all. No bleeding, nothing. In my opinion, the best thing I ever did.